International Nurses Day, but in Uganda, celebrations could be lukewarm as nurses pick themselves up from more than a year of battling COVID-19. The pandemic placed a lot of unprecedented pressure on nurses, and as Leon Sinyanga reports, it's taken a toll on their mental health as well as the wider healthcare system in Uganda.
FLAVIA NAMUGAYI goes about her daily rounds. A year ago, she was being pushed to her limit, working on the front line of Uganda's fight against COVID-19.
This was something really new and no one was really sure of how it spreads, at what rate. It was a disease that just being studied, so there was a lot of fear.
NAMUGAYI and her fellow nurses were worried about contracting COVID-19 and about their families too. But she says she sees her profession as a calling, so she had to keep going.
I entered this profession when I loved the profession. I loved nursing. I wanted to be a medical profession at one point. So my nursing career wasn't put to a weighing scale. I didn't think of any one day that I'm going to quit nursing because of COVID.
Nurses like NAMUGAYI are relieved there are now fewer COVID patients in hospitals. But with the effort they put in, many feel there needs to be more recognition of their work. Nurses have been described as healthcare superheroes around the world, learning how to fight COVID-19 as the months go by.
We have learned the prevention and how best we can manage COVID. And indeed, after all what we have learned, once we put it in practice, it has worked for us, and that's why COVID has reduced.
Fighting the pandemic comes at a cost, though. Some nurses have lost their lives. The working conditions have been tough. The pay is also low. This May, the health workers under the Uganda Nurses and Midwives Union threatened industrial action over a pay dispute.
The most pressing issue is salary increment, salary disparities. If we are graduate nurses, they are graduate doctors, let us all get the same pay. Let our salary also increase so that we can be able to look after our children.
The government has promised funding of up to $130 million for the next financial year. In the meantime, the nurses keep putting in the hours, saving one life at a time. Leon Sinyanga, CGTN, Kampala, Uganda.
Well, over the last year, much of us across the world have retreated to our homes to avoid the pandemic. But it's been rather different for nurses who've had to be at the front line fighting the coronavirus and other diseases. Well, as the world celebrates nurses today, let's speak to a nurse in Kenya to find out more about her experience through this pandemic. We're now joined by Halima Adn, the Director of Nursing Services in Machakos County in Kenya, joining us live via Zoom. Thank you so much for making the time to speak to us, Halima. Of course, it has been unprecedented times, but perhaps very much so, in particular for nurses. If you could give the world a message on behalf of nurses today, what would that message be?
Thank you very much for having me here. First of all, let me wish all the nurses in the world a happy International Nurses Day, all the way from Kenya. My message to the world is nurses all over the world are dedicated to join hands with all the healthcare workers and the governments in the systems all over the world to fight this pandemic. As nurses, we shall not give up. We shall walk this journey with humanity until we are able to defeat this virus. That is my simple message to the world. We promise hope, and we promise that this is going to be over, and we are going to continue with our lives normally as before.
Absolutely. And Halima, of course, the theme for International Nurses Day this year is Nurses, a Voice to Lead, a Vision for Future Healthcare. Halima, what do you think nurses are contributing to our ideas about health in the future?
Coincidentally, the year 2020 was supposed to be the year of the nurse. And I think the pandemic came in to prove that it was indeed the year to prove to the world that nurses play a vital role in the healthcare system. Since the pandemic began, They have remained on the front line to provide healthcare services to individual patients, their families, communities, and even the government by working under tough conditions, especially in Africa, amidst the fear that engulfs the world. Nurses have led in the care provision for patients, and they have remained resilient in the provision of healthcare services. And they still remain the workforce that is giving hope to humanity in the midst of this pandemic.
And Halima, of course, as you say,
all the nurses in the world.
Absolutely. Halima, of course, as you say, this has been a very challenging time for nurses, and they've had to be very resilient in fighting this pandemic. What is the biggest lesson the pandemic has taught you and your fellow nurses?
For me, the biggest lesson is that governments need to prioritize healthcare. Healthcare systems need to be given priority. They need to get enough funding. We have managed patients where even oxygen lacks in hospitals. Focus has been in the healthcare system. We have seen equipment being purchased that were never purchased before. So to the whole world, for us, the lesson is that healthcare must be prioritized, healthcare must be funded adequately, and the health workforce must be motivated, because nurses remain the single most important workforce around this pandemic. So the allocations and the strengthening around healthcare systems must be done, and it's not an option. People need to come together, talk to each other, and ensure that we have working systems so that we are able to save humanity, because that is the core business. For us to have a government that is functional, we have to ensure that people are alive, and it is the government's responsibility to provide and join hands with healthcare professionals like nurses who know what is lacking and what needs to be done.
Absolutely, Halima, and we certainly hope that those who have the authority to do so are paying attention to your message. Thank you so much, and happy International Nurses Day to you and your fellow nurses.